Okay, good afternoon. Salam alaikum to the Indonesians. I know how to say that. That's why I'm saying it. Okay. I decided to talk about this to give a new dimension to health and sanitation and wash. Because usually when we look at or when we hear the links of sanitation and wash, we think of what? Diarrhea and the water-related diseases. No? But unfortunately, to muddle the pot further and to give us more problems, the lack of sanitation and wash is now linked to chronic disease also, or NCDs, no? Non-communicable diseases. So I have 3 discussion points. Hopefully, I will finish in 15 minutes. So we have what we have in the Philippines, sanitation and pollution and their relationship to NCDs and preventing NCDs for survival, the challenges for all of us. Because if we really don't do this, humans will literally die. Okay, the Millennium Development Goal era from 2000 to 2015 was focused on child and maternal health and reducing deaths from infectious disease. No? I think you still remember MDGs. So HIV, there were 3 diseases, HIV, tuberculosis, and malaria. Most countries in the world were able to achieve the targets. In the Philippines, we were able to achieve the targets except the target for maternal mortality. We failed that. No? We did not reach the target. In 2015, WHO, UNICEF, and World Bank announced that childhood mortality had been reduced by half and maternal mortality had decreased by 44% worldwide between 1990 and 2015. The target was actually to reduce by 2/3. So 44 is not yet quite there. So in 2015, enter the SDGs. No? The SDGs include the ambitious and specific target of reducing mortality from NCDs by 1/3 in 2030. If you take a look at the SDGs, they focus very, very clearly on non-communicable diseases. No? The term NCDs refer mainly to the 4 diseases constituting the largest burden worldwide of cardiovascular disease, diabetes, chronic obstructive pulmonary disease, and cancers. Just a quick survey. How many are hypertensive or diabetics in the audience? Show of hands? Okay. Show of hands. Or for the young people, how many have parents who have either end hypertension and diabetes? Okay. It never fails. About 1/3 of the room will always raise their hands. No? Just in case also you're wondering, just being born a Filipino is already a risk factor for diabetes. Sorry. I do not know for the Japanese, but Filipinos we are expected to be the fastest growing country in terms of diabetes up to 2025. These diseases are now the major causes of death in low and middle income countries, including the Philippines. They cause about 70% of deaths worldwide and 67% of deaths in low middle income country, which the Philippines is. We are now no longer a low income country, we are now a low middle income country. This graph just shows, this is from a Lancet article by Nugent R. et al., which appeared last year, that these are the high-income countries, upper middle-income countries, low middle-income countries, and low-income countries. That among the LMICs, this will take the longest to decline. No? So the others are actually faster than us. And this is the burden of the world. We belong there. This is another diagram that shows that the non-communicable disease target is linked actually to the other SDGs. The heavier the line, the more closer it is related. So it's related to livable cities, it's related to sustainable production and consumption, it's related to poverty, it's related to gender, it's related to inequality, and practically all the SDGs. No? So if we do not solve this, we will never meet the other SDGs. Let's take a look at a local data. This is our data from the Northern Mindanao Medical Center where I also work. This is the regional hospital of Region 10. Just looking at the 10 leading causes of deaths in 2016. No? For those of you at the back, if you cannot see it, I will read it out for you. Number 1 is cerebrovascular disease, in layman's language, strokes. Number 2 is influenza and pneumonia. Number 3 is ischemic heart disease, in layman's language, heart attacks. 4 is respiratory and cardiovascular disorders specific to the perinatal period. This is for babies. 5 is motorcycle rider injured in transport. For the first time, this has entered our causes of death. This warranted the statistics office of the hospital to come call me. They told me, please come down. We have something to show you. Okay, number 6 is diabetes mellitus. Number 7, tuberculosis. Number 8, neoplasms of uncertain or unknown behavior. This is cancer in layman's language. Number 9 is arthropod-borne viral fevers and viral hemorrhagic fevers, in layman's terms, dengue. Number 10, hypertensive diseases. If you count the non-communicable diseases, they are exactly 5 or 1/2 of the 10. So 5 are still infectious, 5 are already non-communicable. And this is for a small city like Cagayan de Oro. I do not know what it is in Metro Manila. So I decided to include this because for me, and I hope for you also, 2 revolutionary studies about chronic disease came out last year. No? One is from the Lancet, which I quoted earlier, and I am quoting again now, where very clearly they said pollution is a major contributor to the development of NCDs. So if we want to help, wash and sanitation will help because pollution is a major contributor to the development of NCDs. And direct quote, the time has come to end neglect of pollution, acknowledge that pollution is a major NCD risk factor, mobilize the necessary funding, and make pollution prevention a core component of the intersectoral NCD agenda. We are actually disappointed because the NCD intersectoral group of the world met in October and this was not taken up. So I think this is another very good area for research. The second article is from the Bulletin of the World Health Organization, where they said non-communicable diseases constitute a global security threat. And this is even a heavier statement, no? This is from the Bulletin of World Health Organization, and this came out in the latter half of December, just around a month ago. They said non-communicable diseases can affect personal security in many ways. They are chronic conditions and therefore have a long-lasting impact on health and on the perception of one's personal security and well-being. Evidence suggests that non-communicable diseases contribute to personal poverty, because of their chronic nature, their impact on productivity, and their direct and indirect costs. In the Philippines, we have a very common scenario of somebody from a poor family suffering from a stroke being brought to the hospital, and then the family slowly has to sell all their possessions in order to fund the patient. First, the carabao is sold. Next, the house is sold until the entire family is impoverished. That's very common. That's very common. No? And in the Philippines, maintenance medicines means to take the medicines only when they feel something because they cannot afford the cost. Maintenance is maintenance. Whether you feel anything or not, you take the medication. But in the Philippines, we are so used to that. We doctors were so used to that. Research evidence has magnified the role of lifestyle factors and relegated to the background environmental factors. And it's coming out, it's becoming very clear that the environment has a lot to do even with non-communicable disease. Yet, exposures to pollution are responsible for an estimated 16% of all NCD mortality. Specifically, this fraction includes 22% of deaths from cardiovascular disease, 26% from ischemic heart disease, 25% from stroke, 53% from chronic obstructive pulmonary disease, and 40% from lung cancer. For the longest time, factors for the development of NCDs have focused on lifestyle factors, diet, exercise, maintenance of body weight, smoking, to name just a few. The role of environmental pollution has been relegated to the background. It is not even mentioned at all. No? If environmental factors continue to be ignored, we risk not attaining target 3.4, that of reducing NCDs, of goal 3, health and well-being, of the Sustainable Development Goals. So, what do we do? No? Preventing NCDs for survival. What are our challenges? First, develop the science to produce good evidence. Research, that is the role of universities. In the Philippines, it's very difficult to do research on chronic disease because we have very bad data. I'm really sorry to say that, but the data keeping and the data gathering is not very good. We have, for example, data on the complications of diabetes, but we do not have data on how many people have diabetes. But we know how many of them have kidney failures, which is already the complication. We need to write good research, no? Multidisciplinary. This is what we presented in Finland. I think you still remember, Dr. Yamauchi. So this is the nutritional, the links of water sanitation, hygiene to nutritional outcomes in children, which was also mentioned by Dr. Yamauchi earlier. We have a study, this is done by one of my students, of WASH in schools and how it is related to reading in children. So we need more studies like this, no? We need to communicate our messages effectively, no? So this was, somebody touched on this earlier, I forget who. What the scientists say should translate to what can be understood by the public, no? And we have to mind the gap. The problem usually is we talk to each other. Look at now. Where is the public? We need to change behavior, not only change knowledge. And this is so difficult. I do not know how to do this. So therefore, the RX, the prescription for better health and prevention of non-communicable diseases should be lose weight, stop smoking, eat a healthy, low salt, low sugar, low fat, low cholesterol diet, exercise at least 1 hour 3 times a week, and stop pollution and clean up the environment. It should include that. The doctor should say that, no? So what are my takeaway messages? Number 1, pollution kills 3 times as many as AIDS, TB, malaria combined. So if you really look at the figures worldwide, pollution kills more than all the three diseases combined. We can improve our environment to improve health by so many ways, no? Maraming salamat po, arigato gozaimasu, and terima kasih.